future population and the imperative for change. Right now, if you're a child born after the year 2000, you have a 1 in 3 lifetime risk of developing diabetes. We have 25.6 million people with diabetes. We have 79 million people who meet the criteria of pre-diabetes. How many of you think patients know they have a diagnosis of pre-diabetes? Because we did this with our strategic plan for 2012. 7% of people with pre-diabetes actually know they have it. The latest data from last year is that's up to 12%. That's a tremendous challenge, but it's also a tremendous opportunity. And if you look at global projections for the diabetes epidemic, you can see that this is not just a United States phenomenon. India and China are overrun with this. I have been to Dubai and I've been to India. We'll be going back. And the Mideast is begging for information and knowledge. I talked to one young researcher who had to get permission from the Saudi government to do the research in Saudi Arabia on women at home. And the problem is that if you're a Saudi woman at home, you are not allowed to exercise outside the home. So you have to find strategic, creative ways of achieving exercise goals in a country where the temperature may be 100 degrees and you have to do it inside. And we're going to have 439 million people with diabetes by 2030, if the current trends continue. I was on Capitol Hill in March when they released the new cost numbers. In 2007, the total cost of diabetes in this country was $174 billion. Now, in this day of trillion-dollar deficits and staggering numbers, what does $174 billion look like? $174 billion is approximately the cost it took to clean up Hurricane Katrina by the federal government. Imagine that going forward. Now in 2012, it's $245 billion, which is a 41% increase. Now, you and I take care of a lot of diseases. I don't know of anything that's growing at a cost of 8.1% per year. If you break down the cost numbers, newer expensive medicine driving the cost? Nope. Hospitalizations for people with diabetes driving the cost? No. Actually, hospitalizations were actually down in that period of time. Complications? No, down. What's driving this is the prevalence of diabetes.